Welcome everyone to today's webinar, Managing a Clinically Integrated Supply Chain, What ASC Leaders Should Know. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And if at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are here to help. With that, I'm pleased to introduce today's webinar sponsor, Cardinal Health. Along with a broad portfolio of med surgical products, Cardinal Health has dedicated resources and tailored solutions specifically for the ASC space, making them a leading distributor for surgical hospitals and ambulatory surgery centers. Their tenured team of ASC representatives know how ASCs operate and are there to help your facility reach its goals. They work together with a clinical team of perioperative nurses that work specifically with ambulatory facilities to improve efficiencies and maximize revenues. Their tailored solutions are designed to help ASCs optimize efficiency and streamline their supply chain. We are joined today by two fantastic speakers from Cardinal Health. Penny Williams is a senior consultant of clinical operations for Cardinal Health. Penny has more than 30 years of experience in various healthcare institutions, both in the acute and ASC space, with focus on scrubbing, circulating, and management. Before joining Cardinal Health in 2017, she managed a 5 OR ASC with a staff of 30. Penny is responsible for scheduling, everyday workflow, budgeting, and performance reviews, as well as interfacing with administration, surgeons, vendor reps, and staff. As a senior consultant clinical operations, she conducts operational and supply chain assessments, custom procedure kit reviews and builds, and has led product trials and conversions. She also works with strategic accounts to identify cost savings and efficiencies while promoting and driving growth opportunities. We're also joined by Caitlin Dugan, Regional Director of Ambulatory Surgery Centers for Cardinal Health. During her 11-year tenure with Cardinal Health, Caitlin has worked for various teams in both the acute and non-acute areas of their medical products and services division. Caitlin is extremely active within the organization and currently serves on the Customer Finance Council and leads the Field Advisory Board team. She's also the co-chair of WIN, Women's Impact Network at Cardinal Health. She has a degree in economics from the Ohio Wesleyan University, and she currently resides in Charleston, South Carolina. Penny and Caitlin, thank you so much for being here today. And Penny, I'll now turn the floor over to you.
Thank you. Thank you for the introductions and welcome to today's webinar. I'd like to take a minute to go over the agenda and the topics to be covered. First, we'll cover what a clinically integrated supply chain looks like. Second, the role of distribution in a clinically integrated supply chain. Then, managing resources and improving efficiencies. And finally, assessing your facility for opportunities to improve. I'd like to start by reading a definition of what a clinically integrated supply chain is. I think this is just a really important place to start. So, a clinically integrated supply chain is defined as an approach to deliver patient care with the highest value, high quality, best outcomes, and minimal waste at the lowest cost of care. That is achieved through assimilation and coordination of clinical and supply chain knowledge, data, and leadership toward care across the continuum that is safe, timely, evidence-based, efficient, equitable, and patient-focused. Wow, that's a lot to digest, right? So there are many different definitions out there, essentially all conveying the same message. However, I found this definition from the Association for Healthcare and Materials Management the most comprehensive. Let's begin to look at this and see how an integrated supply chain might be created or even improved upon in your facilities. So now that we've defined it, let's discuss the benefits. So overall, a clinically integrated supply chain allows for more informed product choices, supports quality outcomes, reduces waste, and it lowers cost. It eliminates silos, and silos can be within a facility. A silo can be materials management, another silo can be the operating room, another silo being administration. So we're all in our own little silos working, and we're kind of only focused on what our job is. And by creating these silos, it lacks a meaningful connection and an exchange of information within other departments and entities. So we want to break these silos down and begin to have this meaningful communication and connection. This integration helps to determine the best products that deliver the best care at the best price. This contributes to increased patient satisfaction and efficiency while lowering costs. Standardization of specific products and vendors often results in better contract pricing as well. Less variation in products increases clinician familiarity, which could lead to fewer errors. Reduced product variation also leads to clinical process standardization, improving efficiency as clinicians learn how to use the same products. Now that we know the benefits, let's look at the steps to make this happen. The first step I'll talk about is culture change. So clinical supply integration isn't just a single project or a goal, but rather it's a cultural shift in how a system operates to achieve the best results for our patients, our staff, and the facility or organization. Supply chain costs are soaring and they remain unstable. It's imperative in this culture to find clinically acceptable but cost-efficient products. And you're just going to hear that over and over again in this webinar. It's so important. Direct and support the need for formulary compliance as opposed to physician preferences. And we also need to be sharing the cost of supplies with our staff. Supplies don't come with a price tag, and many of us are unaware of the costs of the supplies and products that we use every day. A clinically integrated supply chain also has the ability to measure and monitor performance to include clinical measures of success, and it can consider performance relative to our peers. This data will support where your opportunities are, and it's the foundation of a clinically supply integrated that drives sustainability. Contract compliance needs to be monitored in order to make adjustments and to help us lower costs. Next, we'd like to get into how to best work with your distribution partner, but first we'd like to learn from you.
Thanks, Penny. So here's what we want to know. Here's the question that's on our minds that we'd like to learn from you on. What does a good distribution representative look like to you? They're a very integral role in the supply chain. And what we want to know is, what on this list that we're about to share with you, what's the most important to you? Is it that they visit and communicate on a regular basis? Quick response to emails and calls, is that really of the utmost important? Is it follow through with to-dos after you have meetings or exchange emails back and forth? Is it that they recommend solutions and product updates? Is it that they explain the benefits of buying the products they are selling? Is it they provide regular savings opportunities? Do they share data and analytics to help drive supply chain insights? Is that really helpful to you? Or is it that they're really transparent and trustworthy with you? They're a partner. They're somebody that you can count on. You know, Penny, as the audience is answering this question, I know you're out in the field a lot. You work with a lot of different reps. You've run a facility yourself. I'd love to hear your thoughts on what you see across the country as being the most valued in a good representative.
Thanks, Caitlin. You know, they're all so important, but I continue to hear everywhere I go that communication or a visit on a regular basis is just truly valued. Maybe regular visits aren't always necessary after that relationship's built, but some form of established communication to touch base should always be in place. The second is following through with your to-dos. Send a follow-up email to confirm what you've agreed upon with your distribution rep, the plan of action. Just it's nice to touch base with an email to follow up and conclude that you're both on the same page. And then do what you say you're going to do. Actions always speak louder than words, and this helps to build accountability and trust. How many times have we all heard, we never see that rep? Once they sold us something, they disappeared.
Yeah, that's great. And it's part of what we're going to get into, right, in our talk today is communication. It's really key in developing a good partnership. So we're going to give everybody just a couple more minutes to wrap the questions and provide your answers. And we're going to dive into the next section of our presentation.
Caitlin, why don't you take us through how a distribution rep can be of value in a clinically integrated supply chain and what they can offer?
Sure. Thanks, Penny. So the role of distribution in a clinically integrated supply chain, one of the most valuable resources that you have is your rep. I'm sure as many of you out there were considering the question that we just asked in the poll, you were going through your Rolodex of representatives and thinking through, hey, what makes a good rep? What is that to me? Why do I value this person so much? And on the flip side, you probably were thinking through some reps that maybe don't meet your standards and the reasons why. The experience with your rep, especially if they're a good one, somebody that's highly communicative and responsive, can really entirely change your relationship with an entire company. You know, as I'm out in the field with my reps, most customers, they make sure they go out of their way to let me know about their rep experience, whether good or bad. And it's really important because it really does, as your supply chain partner in a distributor, make a huge impact on your day. Distribution and managing supply chain can often be really complex and overwhelming. You know, we employ representatives to help with that journey and make sure there is a smooth experience. Now, of course, part of the journey is sales. That is an aspect of what we're doing, but also a big part of the distribution function is service as your distributor. You know, a good rep should really be, as to the poll results that we saw there, somebody that is extremely responsive, organized, and resourceful. It's got to be somebody that you can trust and rely on. And, I would caution when evaluating any distributor, it's really important to meet that person and get to know who your rep is. That's going to be somebody that you're communicating with on a very regular basis. You can ask other centers in the area, hey, what is their reputation? How do they work with you? Are they somebody that can help you in a pinch when you forgot an item? Are they providing savings? Are they showing their value? The rep is there to be your resource, and you should be leaning on them for support. They are there to help. I think a key part in making the partnership work with your distributor is also setting clear expectations up front on both sides. If you can both sit down and agree to the way that you all like to work together, how you best like to receive information, what you need from from your representative, is it specific reporting? Do you prefer that they text you during the day? And also on the same side, your rep should be letting you know, hey, I have some reps that will put an out of office on Tuesday to Thursday when they're in the field, and their customers know I need to text if there's an emergency. Otherwise, they're going to get to it as soon as they get home from being off the road. So little things like that, I think, can make a big difference in the relationship and partnership and help it go really smoothly. When you're both lock in step from what you expect from each other, that's what really builds a strong partnership. I also find that it's important to set up front, what is your meeting cadence? Are you meeting live? Are you using Zoom? Is that easier for you? What makes most sense? And then when you do have those meetings, I always find some of the best reps that I work with, they have agendas, and they're also asking their customers, so you all up front, what items do you need from me that maybe I need to do some work on beforehand? And then you can both come together on, especially if it is a live meeting and valuable time, what you all are going to cover and accomplish during that hour and a half session so that you can be productive and move forward. So next, beyond the rep, I want to dive into some of how the data and analytics that we have access to as a distributor can really help create efficiencies in the ASC. So as distributors, we have access to large amounts of data that we can use to help you improve your supply chain and create efficiencies. Some of the reporting that we can dive into is SKU rationalization. Are you buying multiple SKUs that are similar and can be standardized to one potentially? Savings analysis. Where are you paying too much? Are there rebates you could be taking advantage of? Are there preferred products that would be giving you a deeper discount or a reduction off your markup, excuse me. Your rep can dive into all of that. From a GPO perspective, are you buying things off contract? How is that impacting your bottom line? We often also like to connect with whoever your local GPO rep is so that we can communicate and help work and make sure that that GPO is also working for you. We have things well connected, and if issues arise, we know exactly who to go to. So that's a really important part. There really are multiple reports that could go on and on that we can run to help you analyze your current business and make sure your stock is working for you and saving money. But a lot of it is just coming together with your rep and just understanding your needs so that you can let them know and they can help tailor reports to you. You know, with what we've been going through with the pandemic and just the uncertainty of supply chain right now globally, there's also various predictive analytics out there that we have that we can help you provide direction on the flow of goods into the network so that you can see at least directionally, hey, when are these goods set to be received? What does the outlook look like if there's maybe an interruption service, so that you can start to get an idea and a picture of what it's going to look like holistically to help you prepare and make sure that you're assessing your supply chain appropriately and your part levels. You know, finally, I want to move to a really important aspect of the partnership between the distribution team and the ASC, which is conducting regular business reviews and scorecarding. You know, it's really extremely important to make sure your reps are providing business reviews for you on a regular cadence. This is their chance to show you what value they are providing. They should be creating a scorecard for you and showing you, hey, these are the savings that I've presented throughout the year. Here's how much money that I've saved you. You know, they can also pull data on inventory analytics like fill rates, back orders, top spend by manufacturer. This is another time really for you and the distributor to communicate and make sure that when you sit down, this is meant to be beyond the day-to-day in your strategy session. So this is also a time where you talk about goals. Typically, when you're working with a distributor, it's not just for a year. You're together in a partnership for multiple years. So discussing and talking through, here are my goals over the next 2 to 5 years. This is where I'd like to get from where we're at. How can we collaborate and work together? I think this is really your time to do that, to get out of that day-to-day pricing issues that need to be fixed or what have you, and talk strategy and talk future. You know, this is also a time for your distribution partner to expose you to new and different ideas. What are they doing to innovate? Who are they partnering with? What is coming down the line from their aspect? And also you can share too, this is how I'd like to innovate. This is what we're looking to get to. And these times are really, again, like I said, that strategy time for you all to sit down and think through, hey, where do you want to go in the future? And how can you all work together to get there? So now that we've discussed some ways in which you can maximize your relationship with your distribution partner, it's clear that a giant part of all of this is communication. At this point, we'd love to hear from you again, the audience, and understand what type of communication is most impactful to you. How do you like to receive and distribute information? So we've listed out a couple options here, internally and externally, and we'd just love to know what's most important. What is your go-to? Is it email? Is it internal huddles? Is it communication boards that you have up in your facility? Do you all come together in staff meetings regularly to discuss? Are there chat platforms? I know we here at Cardinal utilize Microsoft Teams a lot. We're constantly on there using messaging, and that's a great form of communication. Are you on the go a lot? So it's really text. Text is what's going to be able to be at your fingertips and help you communicate. Is it Zoom or a phone call? I know that, throughout the pandemic, with not being able to see people in person, Zoom is a great platform to be able to still connect and see somebody face to face. Or is it individual one-on-one meetings? Are you getting back to that? Is that really your preferred mode? and the best method for you to communicate? You know, Penny, I'd ask this of you again. I know, again, you're out in the field a lot. What type of communication do you see most often used in the field?
You know, I honestly have to say we're all texting today, and that just seems to be the next best thing to a person-to-person conversation sometimes. We've all got our phones, and there is appropriate place in the operating room to text. Obviously, we don't want it to interfere with patient caretaking and texting while we're in the operating room involved in cases. But when it's appropriate, it's a quick and easy way to reach a group of people, disseminate information, and get responses back. Not every facility has huddles, and staff meetings might only happen once a month. So probably the next best form of communication I see are communication boards. They can be hung anywhere. They can be in break rooms, locker rooms. They can be at the OR desk. Information is hung on these boards, and everybody's held accountable to read this information, sometimes by even initialing that they've read it, and then they're held accountable for it. Any form of communication is valuable, and it's obviously going to vary from facility to facility, just depending on what works best for everyone out there.
Yeah, that's true. Everybody, has their preferred way and a technology that they're comfortable with. So it's very interesting to see, how best people send and receive information.
Definitely.
So we'll give everyone just another minute here to wrap up and provide your answers, and then we'll move on to the next slide. So now that we've seen how you all prefer to communicate, Penny, would you like to take a deeper dive into what that might actually look like?
Yeah, thanks, Caitlin. I'd be happy to do that. So let's talk about open communication with clinicians. Communication is defined as transferring information to produce greater understanding. That sounds so simple, doesn't it? But it's not always that simple, and the old saying goes, sometimes there's something lost in communication. So communication helps us to understand information more accurately and more quickly. And I think a really important part to communicating, especially about today's environment, is to maybe educate our staff on the global supply chain constraints. They might not all know the big picture, and they're wondering why we're not getting products and supplies. Well, our products and supplies might be out there on the oceans, and they've been floating around waiting to get into ports. And once they make it into ports, it takes time to offload those, and then there's a backup at the ports. Truckers are waiting to pick them up and take them up to storage facilities and distribution centers. And like everywhere these days, there's shortages of workers. So that work just accumulates and backlogs, and it gets worse and worse. So I think if we look at the big picture and understand that, it helps us understand why maybe we're not seeing the products and the supplies that we're used to, and we're having to make some substitutions. The Institute for Supply Management found that 75% of companies they reached out to in February and March of this year, and they weren't only healthcare companies, but they were experiencing some sort of supply chain disruption due to the pandemic. And 44% of these companies said they did not have a plan in place to deal with it. They were caught off guard like most of us. This just continues to snowball and accumulate since the beginning of the pandemic, and then we had to deal with the Suez Canal incident, and that just contributed to an already bursting at the seams situation. I read just last week that there are 400 container ships waiting to get into the ports of Los Angeles and Long Beach. Each of those ships can contain up to 8,000 shipping containers, which hold all kinds of products, not just healthcare supplies, but I think that we all know that a lot of them can be our healthcare supplies that we're waiting for. We're going to catch up eventually, but it's going to be a long process, and it could take weeks or even months for this to happen. So because of all this, we just need to be so transparent with our staff regarding substitutes or alternate products and manufacturers that we might be utilizing during this time until the supply chain catches up and operations can return to more of a pre-pandemic state. We need to encourage our staff to support open-mindedness, especially with our physicians and surgeons. We all tend to buy into change more when we feel like we have a say or we're part of a solution. Physicians and our surgeons tend to be the most passionate about the products that they touch and feel and wear and their specialty products, not so much with our commodity items. But we need to encourage our staff, especially the scrub techs who work up closely with the physicians and have conversations with them during cases, and they can help encourage and influence the adoption of different products and standardization. And it just, we all come to jobs with prejudices and preferences from previous positions, and we just need to leave those behind, be positive, and move forward. Caitlin, now that I've talked about communication with clinicians, would you like to discuss effective communication with distribution reps?
Sure, Penny. Yeah, thank you. And that was really well said, right? So just to follow up and to add on to Penny's points there, like we keep talking about, it's really imperative that you have frequent and open lines of communication with your distribution partner. As Penny just spoke through, right? There's a lot of moving parts, especially right now with back orders, allocations, supply issues. You got to make sure too that your rep should be filtering information to you in an easy format that then you can turn around and provide to your staff when necessary. Because obviously that's really important. There's a lot of communication that you all need to have internally. And if you don't like Excel, you prefer something embedded in an email, you can ask for that. Your rep is there to help make it easier for you to get your communication out to facility. They should be feeding you the information that you need in a way that you want to see it. And communication really is a two-way street. It's really imperative that you all are communicating frequently and often in the way that's easiest for both of you to best receive that information. I know right now, an example is we're hearing a lot of local hospitals are shutting down because of the Delta variant spike, and patient volume is shifting to the ASCs. That's something that we here need to know right away so that if you're working with us or potentially through a third party for your custom packs, you need to increase forecasts and make sure that we're getting you to that level too. And from the rep side, right, if we get wind that something's about to go on back order, we need to communicate that to you as quickly as possible and help you come up with a plan B or provide you with your allocation so that you know what to expect. I think in general, this past year has been extremely challenging for people, both personally and professionally. And I think as I speak with my reps and visit people in the field, I try to keep top of mind that we all need to have a little bit of empathy with each other, especially from our reps to the facilities that they work with. There's a whole host of different stresses that are happening professionally, but now layered in with it personally. People have children at home that are dealing with virtual schools. There could be elderly people that you're working to care for. It's just a lot. It can be very, very burdensome, on top of just managing the supply chain, which in itself is very complicated. So frustrations can get high. And I, coach my reps to help them understand that we all need to step back, take some time to listen, have some empathy. We are here to partner with and hopefully help remove some roadblocks to make your life easier at the facilities so that you can get the supply chain running as smoothly and efficiently as possible. So really open, clear communication, really trying to be proactive with your communication. It is extremely key when working with your distributive partner. So I know we've talked a lot now about what a clinically integrated supply chain looks like. We've discussed the role of distribution in a clinically integrated supply chain and managing resources and improving efficiencies. So Penny is going to move on now to really get into the meat of and discuss how to assess your facility's supply chain. So Penny, I'll kick it over to you.
Thanks, Caitlin. So what practices or processes can we implement to optimize a supply chain in this challenging and complex environment? So let's begin with conducting a doc-to-doc walkthrough. I love this analogy of doc-to-doc. I've adopted it from a coworker. Thank you, Marvella. It's just a great snapshot of from the beginning when deliveries arrive at your facility to when the product is in the hands of the end user. Do a walkthrough from where your supplies and products are received, unpacked, stored, placed on the shelf, pulled for cases, opened for cases, and finally into the hands of the end user. Along that path, you can identify ways to improve or streamline the process if possible. You want to look at optimizing your storage space, both vertically and horizontally. We all know that most ambulatory surgery centers are storage challenged. Sometimes something as simple as creating a suture wall by hanging your suture on unused wall space eliminates multiple rolling suture carts and frees up floor space. Sometimes it's something as simple as that. It also makes pulling suture easy to see and at a glance, and in turn can help case pick be easier. Be vigilant regarding ever-changing schedules, case volume, and case mix. Now with some states, as Caitlin said, and hospitals postponing or moving elective surgeries to the ambulatory surgery space, this is more important than ever. We need to maintain supply room inventory, PAR levels, and sufficient packs. It's always crucial, but now more than ever. We need to find that balance between the number of cases, the supplies used for those specific procedures, and inventory on hand to accommodate our constantly changing and challenging circumstances. All of these measures together contribute to optimal OR performance. So this brings up the question, what supply chain activities should our nurses be involved in, being as they are some of our highest paid employees? Do we want our nurses managing inventory when they are some of our highest paid employees? So one of the activities that I think is really important and that our nurses can be involved in are preference cards. They're sometimes referred to as recipe cards for a very good reason, and they're critical to accurate case pick, inventory management, and cost. None of us like it. It's time consuming, but it's so important to keep these preference cards up to date and accurate. Preference cards and their maintenance can also be tied to supply inventory management. So poor or no maintenance of these cards leads to waste, time to return items to inventory after cases if they're not used, and the labor at the front, which is case picking. There's also the mindset in some facilities, and you'll all kind of chuckle at this, but there are the nurses that don't like to update preference cards because they just know that information and they can think of themselves as the go-to person for that procedure and that physician. They always have the answer. This causes other clinicians in that situation not to have what's needed in the rooms, and then they have to leave the room to get it. This behavior doesn't support a clinically integrated supply chain. It should be called out and it should be discouraged. When clinicians are involved in the procurement process, it increases the quality of patient care and it decreases cost by offering like products on an even playing field. Pack review is also another important activity in collaboration with supply chain or materials management. Put your items in those packs that are being pulled on a consistent basis from the shelf. If you're pulling a single sterile item off the shelf, 85 to 90% of the time, you want to put it in that pack. This potentially frees up some shelf space, it optimizes your custom packs, it facilitates turnover time, and it's often, more than not, a cost savings. So with this being said, how do we source, evaluate, and agree upon clinically acceptable products? One of the ways I like to look at getting everybody involved in finding clinically acceptable products is to have trials and evaluations. So trialing products and evaluating samples is a great way to accomplish this. It's not always necessary with all products or changes, but it is for some. So these trials and evaluations should be well planned, thought out. They should involve as many of your staff and physicians as possible to get feedback and be supported by clinical champions and leadership within that facility. Feedback, both negative and positive, from these evaluations should be addressed daily, and they shouldn't wait until the end of the week. Sometimes I've done trials and evaluations and they want us to collect them or they want us to turn them into the staff and they want to look at them all at the end of the week when we're leaving the trial. And this is an opportunity to turn any of the negative feedback into a positive experience. We haven't had time to address it. So surgeons are the ones that are definitely more passionate about the things they actually touch and feel, the gowns, the gloves, the drapes, and their specialty products. They want a voice too. They want to be heard and they want to give feedback. We all know that awful situation when you've put something new in a surgeon's hand that they've never seen before. Awkward. You'd rather be updating your preference cards, right? And then remember that techs have the ability to influence and steer the physician's acceptance or rejection of products. Supply chain costs are soaring, and they're going to keep soaring, and they remain unstable. It's beyond important in this culture to find clinically acceptable but cost-effective supplies. We need to shift our focus to preferred products versus those that are preferences from clinicians and preferences from physicians based on their long-term use and what they're familiar with and comfortable with. So in summary of this information we've just reviewed, what can we do moving forward? Remember that lack of inventory unnecessarily increases a clinician's workload. It results in time away from care delivery to search for items out of the room. This can lead to the perception that patient care and those clinicians aren't important to a facility or an organization, and that can result in high turnover and burnout rates. So we always need to go back to supporting the products, again, that are clinically acceptable but cost-effective. It's challenging for all of us to be exposed to new and to use new or different products, sometimes without any input about those products. We're all creatures of habit, and most of us don't embrace change. So just take a minute and ask yourself, stand back and say, is this clinically acceptable? If the answer is yes, then let's be positive and move forward. We also, as Caitlin said, need to be empathetic. We need to be empathetic to our materials staff, working to get whatever products they can. Sometimes during this pandemic, from eBay, from Amazon, and sometimes even from the gray market. And then again, with empathy, it just goes a long way. We all have professional as well as personal challenges, like Caitlin said. With this in mind, don't make assumptions that if products are different or unavailable, that someone didn't do their job or something slipped through the cracks. Something as simple as giving the materials manager a heads up if you take the last item off the shelf could be a helpful reminder to someone else who's on overload. This is all part of breaking down those silos and being more collaborative. Next, let's discuss the benefits to everyone by clinically integrating our supply chains. So collaboration between supply chain, clinical specialties, physicians, and finance can promote efficient and effective decisions. Better management of product sourcing, selection, and standardization of supplies can both reduce costs while increasing clinical quality. Clinicians and physicians need to feel that they have skin in the game and that they're not just a pawn in the corporate structure. Sole sourcing contracts can also be beneficial in that they help to offer lower production costs, and there's fewer contracts to negotiate, and ideally a better value for the price. Strains on our surgery center budgets from impulse buying to have all of these extra supplies on hand has amounted to a large percentage of budgets being devoted to the supply chain and being taken away from facility growth initiatives. So a good relationship between clinicians and supply chain leads to better product selection that meets the clinician's needs, therefore leading to better patient outcomes. These outcomes can be reduced length of stay, shorter operating room time, fewer readmissions, or even less complications. So if there's been a silver lining to this pandemic, it has been uncovering many opportunities for supply chain improvement. So hopefully, after listening to this webinar, you've learned a thing or two about clinically integrated supply chain, But right now we have one more question we'd like to hear your thoughts about. Caitlin, can you take us through this poll?
Of course. Thanks, Penny. And like Penny said, hopefully this got your wheels turning. So what we want to know as a final wrap question, if you could implement one change in your facility, what would it be? Better communication. Talked a lot about that. Better use of resources. Less clinical time spent on managing materials. Is it reducing SKUs and creating more space in your storeroom? Identify more savings opportunities. Penny, I'll ask you one final question here. As you've gone around to facilities, if there's suggestions that you've made during an assessment or just in working with folks, what thing do you think, what is one suggestion that you've made that you find people are really excited about, that really makes them feel like they're going to make a big change and impact on their facility?
I think everybody's very focused on cost savings opportunities, right? And I'll go back to those PAC reviews and how important that can be for cost savings opportunities and standardization of items on your shelf. And again, that it all goes back to communication, right? If somebody goes to pull something and there are 3 different kinds of suction tubing on your shelf, why can't we have a discussion about why do we need 3? Why can't we standardize down to 1? So there's so many opportunities for cost savings that we don't even think of on a daily basis. Something as simple as looking at the number of OR towels in your packs. We think towels aren't a big deal, right? But there's a price tag associated with that one towel, and it could be 35 cents. If you've got 10 too many towels in a pack, that starts to add up over a year and could be a significant savings for you. But again, it all goes back to communication, talking to each other to get the wheels in motion and to start making some of those changes.
That's great. Yeah. And it makes it so real when you put dollar values, right? Even if it's just towels, but how, when you quantify those on an annual basis, what actual impact that has.
Right. Yeah. A thing I used to do too to try and make people aware of costs was I had a staff meeting once a month, and I would try and bring 2 items to a staff meeting, and I would hold them up and ask the staff what they thought they cost. And then I would tell them what it actually cost. And that is so impactful. I can't tell you. People just don't realize the cost of the supplies and the products that we use. And once we make them aware of that and they can wrap their heads around that, I think they're a lot more willing to help make changes in our facilities and help us save money.
Yeah, that's so interesting. What a good tactic in a way to really shine light on the cost of things. Well, now that we have all the responses in, we're going to move to just our final slide here. So as a final wrap up, we here at Cardinal Health have an assessment process to help you conduct a review of your supply chain with 2 different options. We have a clinician-led assessment with one of our clinical team, or a rep-led assessment with one of our very knowledgeable local representatives. So during this process, we really look to bring in a fresh set of eyes. To Penny's point, as she was talking earlier, do you have multiple different SKUs of suction tubing, or how many towels are not being used? Being able to uncover some of those process improvements can be really valuable and add up over a year when you really take that lens to it. We use our supply chain expertise to evaluate your facility's current supply usage and look for efficiencies. And also when you do this assessment, we provide reporting after, so you'll have access to more resources, data and analytics to help you find opportunities, if you choose to implement them. And even analyzing a big spend is your pre-source packs or your custom packs that you're using. And we always look for opportunities to save there. We always suggest reviewing those at least annually because things change. You have different staff in the facility, different preferences change. So there's always room for a cost savings there. So you can visit the webpage shown here and linked in the resource section in the webinar platform, or you can simply send us an email to submit a request and apply for a supply chain assessment. So on behalf of Penny and myself, we really want to thank Beckers for having us today. And we want to thank you all for taking this hour out of your day to listen to what we have to say. We hope that you found this very valuable, and maybe if we gave a tip or trick or something that you can do and implement to help, facilitate at your facility, it'd be really impactful for us. So thank you all for your time today. Now we're going to open it up for some Q&A.
Wonderful. Well, thank you so much, Penny and Caitlin, for just a great presentation today. It was full of just, I think, valuable nuggets of information for our audience. And we will now begin today's question and answer session. So for attendees on the line, you can submit any questions you have by typing them into the Q&A box you see on your webinar console. So with that, let's go ahead and get started with the first question we have here. So the first question here is, how have you seen ASCs use technology to better manage a clinically integrated supply chain?
Yeah, so that's a great question. I'll take that one on. I don't think we typically, especially when you're looking at the supply chain area, a lot of the technology I do see out there to help you manage supply chain can really be very cost prohibitive to the ASCs. What we typically see is some type of inventory management system. I know there's iOS and Envy. There can be something as simple as barcode scanners. I know, stepping up a couple levels, there's some RFID technology out there. But again, I think that it comes down to what the ROI is. And ASCs typically run pretty lean. They're not looking to spend a lot of extra money. And you don't always need the big fancy systems to be able to make the impact or have things run smoothly. So at this point, yeah, it's some pretty basic solutions that I typically see out there. We haven't seen a ton of advancement there, just solely really because of the cost of it. And you just really have to, anything you're assessing, make sure the ROI is there. That's obviously a critical piece of investing in any technology.
Great. Thank you, Caitlin, for that terrific and helpful answer, focusing on ROI, especially in the surgery center space. The next question that we have here is talking about the relationship between materials managers and clinical staff. So the question is, are there specific decisions or tasks where you would recommend strong collaboration between materials managers and the clinical staff?
Caitlin, I'll take this one. So strong collaboration is always important, not just in specific circumstances, right? However, with that being said, a task I would go back to is preference card maintenance. When cases are picked accurately, cases go smoothly, there's less stuff to put away afterwards, there's less or no waste, and there's less frustration on everybody's part. When preference cards are incorrect or outdated, it causes the ball to start rolling downhill. Missing supplies, everybody gets frustrated, inefficiencies and delays in cases, disrupting OR utilization, and creating waste. And at each of these steps along the way, there's money, there's a cost associated with that. So supplies need to be in the right place at the right time and for the right case. This improves OR utilization to the maximum, which in turn is a win-win for everybody. So again, I just can't say strongly enough how important that preference card maintenance and management is. And then also in some of the smaller ASCs that I've seen is the materials manager wears two hats. Sometimes they're a scrub tech as well as the materials manager, and they could be called upon to fill in to scrub in a room if there's a sick call. They can be called upon to give breaks and lunches, or they might even have some other responsibilities. I've seen scrub techs that are kind of in charge of the PAC program at their facility. In those cases, we all need to jump in and help them with supplies and inventory. And then again, that communication is going to come into play with that. If they're scrubbed in a room, we need to utilize a communication board for them to leave them notes, leave them empty raptors of what we've pulled off the shelves. We just need to be sympathetic to that. They might be wearing more than one hat.
Great. Thank you for that recommendation and helpful reminder about the role of some of our material managers. The next question that we have here is, do you know if all distributors provide scorecards and business reviews?
Penny, I can take that one. My experience has predominantly been with Cardinal Health. I can't say with certainty that yes, all distributors will provide scorecards, but it really doesn't need to be anything overly complex. It can be as simple as an Excel spreadsheet documenting all of the savings that have been presented and taken advantage of, or the opportunities that were missed too. So you can showcase what has been shown and what maybe didn't work for this facility, but at least you get that full picture. So yeah, I can't answer that with certainty, but if you're not getting a scorecard currently, please ask for one. It can be built and made very easily. If they don't already have something they can pull from their system to send to you, they can certainly build one. And I think it's definitely a very important piece so that you can use that with your leadership to show them, hey, here's what the distributor is working to provide for me, and here's how they're saving us money. So really critical piece. And if you're not getting it, ask for it. It's not anything overly complex.
Great. Thank you, Caitlin. And we've got time for just one more question. I think it's a great question to end on. We know we can improve performance, but it always feels like we're too busy to think about it. So how would you recommend finding the time to implement any type of process improvements?
Caitlin, I'll take this one because I can't tell you how many times I've said I don't have enough time. So process improvement, right? It's a critical tool. It helps us to improve financial performance and helps improve patient outcomes. We've all said it. I don't have enough time. There's no time. We're too busy. And it certainly feels real at the time, like we truly don't have enough time. But it can't be the end of the story. It just becomes a vicious cycle if you keep saying that. Too often, the phrase "don't have enough time," it's just accepted and nobody challenges it. So what are we going to do? We can't just give up, right? So I believe that we all know that we have slower times in our surgery center. It could be time during a day, time during a week, or even a seasonal time during the year when it's a little bit slower than usual. So to be prepared for these times, I think it's a good idea that we could have a suggestion box in place or a communication board to put suggestions for process improvement on that, so that when we have the time, we can sit down and start to tackle those ideas that have been suggested in that box or on those communication boards. And when we have a slow day, don't let your staff go home early. Don't give them the option. Leadership needs to support this. Lots of times you'll hear, no, when it's not busy and case volume is down, you need to go home. And this might be viewed as non-productive time, but it's really not. And it's essential time for improvement in the future. Another idea is to form a task force in your facility. Have a representative from anesthesia, perhaps the medical director, clinical director, and maybe even someone from administration, as well as the materials manager. If you can't meet on a regular basis, perhaps you could have a working lunch. Maybe the surgery center can bring lunch in, and for 30 or 45 minutes, you can start to go over these ideas and put your thoughts together on how to improve performance. It needs to be a priority, and if it's a priority, then we have to make time for it. And I think sometimes when we say we don't have time, it's really more of a perception at the time that we're saying it than it is a reality.
Terrific, Penny. Those are some great ideas to end on. And that is all the time that we have for today. So I want to again thank Penny and Caitlin for their excellent presentation, and to Cardinal Health for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today. We hope you have a wonderful afternoon.